Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम वेस्टर्न कोलफील्ड्स लिमिटेड स्टाफ नर्स एग्जाम 2019 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 76 Frozen DPT vaccine should be A. Shaken thoroughly before use. B. Should be melt before use. C. Discarded. D. Brought to room temperature before use. Correct answer C. Discarded. 77. The most common cause of maternal mortality in India is A. Obstetric hemorrhage. B. Anemia. C. Abortion, septicemia. D. Obstructed labor. Correct answer A. Obstetric hemorrhage. 78. For treatment of class 3 dog bite, all of these are correct except A. Give immunoglobulin for passive immunity. B. Give an ARV. C. Immediately stitch the wound under antibiotic coverage. D. Immediately wash the wound with soap and water. Correct answer C. Immediately stitch the wound under antibiotic coverage. 79. The vaccine administered as nose drops is A. Rubella. B. Poliomyelitis. C. Influenza. D. Measles. Correct answer C. Influenza. 80. A freshly prepared or solution should not be used after A. 4 hours. B. 6 hours. C. 12 hours. D. 24 hours. Correct answer D. 24 hours. 81. ECG changes in myocardial infarction as A. ST segment elevation. B. YQRS complex. C. Presence of U wave. D. Prolonged PR interval. Correct answer A. ST segment elevation. 82. While doing ECG, V2 electrode is placed in just to the right. A. Fourth intercostal space of sternum of. B. Fourth intercostal space just to the left sternum. C. Fifth intercostal space in mid-clavicular region. D. Second intercostal space just to the left of sternum. Correct answer B. Fourth intercostal space just to the left sternum. 83. Which of the following is used as an antidote poisoning? For organophosphorus. A. Atropine. B. Adrenaline. C. Avil. D. Amiodarone. Correct answer A. Atropine. 84. Which of the following action should a nurse take first when caring for a patient with cardiac arrest? A. Initiate cardiac monitoring. B. Provide intravenous access. C. Establish an open airway reading. D. Obtain pulse oximeter. Correct answer C. Establish an open airway reading. 85. Which one of the following nursing measure will be most appropriate in a patient with epistaxis? A. Tilt the patient's head back. B. Place the patient's head between his legs. C. Pinch the nose and have the patient lean forward. D. Place warm compresses on the patients. Correct answer C. Pinch the nose and have the patient lean forward. 86. Which of the following drug is to be withheld if the patient pulse in less than 60 per minutes? A. Digoxin. B. Dopamine. C. Dobutamine. D. Phenytoin. Correct answer A. Digoxin. 87. Patient blood sugar is 40 mg per deciliter. Immediate management is to administer A. 5% dextrose. B. 50% dextrose. C. 10 units of human insulin. D. Normal saline. Correct answer B. 50% dextrose. 88. Bed sores can be best prevented by A. Frequent change of position. B. Massage the reddened area. C. Use of hard air mattress. D. Back care. Correct answer A. Frequent change of position. 90. A patient with myocardial infarction is receiving FGTN. Which of the following should be assessed frequently? A. Blood pressure. B. Blood glucose. C. Breath sounds. D. Urine output. Correct answer C. Breath sounds. 90. Which of the following condition is manifested by increased intraocular pressure? A. Cataract. B. Conjunctivitis. C. Dacrocystitis. D. Glaucoma. Correct answer D. Glaucoma. 91. Which finding might be seen in a neonate suspected of having an infection? A. Flushed cheeks. B. Increased temperature. C. Decreased temperature. D. Increased activity. Correct answer B. Increased temperature. 92. During which stage of labor would the nurse assess crowning? A. First stage. B. Second stage. C. Third stage. D. Fourth stage. Correct answer B. Second stage. 93. A pregnant lady's LMP is on 5 July. Her ADD should be A. The 2nd of January. B. The 28th of March. C. 12th April. D. 12 October. Correct answer C. 12th April. 94. Which hormone is administered for stimulation of uterine contraction? A. Estrogen. B. Fetal cortisol. C. Oxytocin. D. Progesterone. Correct answer C. Oxytocin. 95. The placenta should be delivered within how many minutes after the delivery of the baby? A. 5 minutes. B. 30 minutes. C. 45 minutes. D. 60 minutes. Correct answer B. 30 minutes. 96. Dark brown vaginal discharge and a negate pregnancy test is seen in which type of abortion? A. Threatened. B. Imminent. C. Missed. D. Incomplete. Correct answer D. Incomplete. 97. Greenish yellow color of amniotic fluid indicates A. Fetal distress. B. Ra incompatibility. C. Post maturity. D. IUD. Correct answer C. Post maturity. 98. A woman has given birth at 42 weeks gestation. When assessing the neonate, which physical finding is expected? A. Sleepy lethargic baby. B. Lanvago covering body. C. Desquamation of epidermis. D. Vernix casicosa covering the body. Correct answer C. Desquamation of epidermis. 99. On which of the following areas a nurse would expect closma? A. Breast, areola, nipple. B. Chest, neck, arms, legs. C. Abdomen, breast, thighs. D. Cheeks, forehead, nose. Correct answer D. Cheeks, forehead, nose. Saw. When should the nurse transport multipara patient from labor room to delivery room? A. When cervical dilatation is 8 cm. B. When cervical dilatation is 10 cm. C. When cervical dilatation is 9 cm. D. When patient feels urge to push. Correct answer B. When cervical dilatation is 10 cm. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज़।